Hi, my name is Stacey Whaley, and the peer-reviewed journal article that I chose for this week's assignment is The Healthcare Iron Triangle and the Patient Protection and Affordable Care Act, and how these two aspects kind of go together. In fact, these two acts function as a barrier to attempt to break the iron triangle. So before I start talking about how these two acts attempt to break the barrier of the iron triangle, I'll discuss what the iron triangle actually is. The iron triangle is a self-reinforcing system of 3 points, which is where the scenario comparison to a triangle comes in, and those 3 points are access, quality, and cost. Essentially, the barriers of the iron triangle is whenever healthcare professionals attempt to come together to improve access, equality, it usually takes the focus away from cost, or doesn't give it the time and attention that it needs, or it worsens this aspect of the healthcare industry. So basically, the barrier lies within you cannot improve all three aspects of the iron triangle without worsening one point while improving two other points. So these two acts, the Patient Protection and Affordable Care Act, were designed in order to increase access, improve quality, and lower costs. Whenever I think of a situation that really exemplifies the barriers of the iron triangle within the health care facility where I'm completing my internship, is daily I attend a meeting called Patient Focus Rounds, where the physicians are focusing on the patients that they are trying to get discharged, and occasionally a patient will come in and they will be admitted and they won't have health insurance. So whenever the nurses and physicians and pharmacists and dietitians all come together to attempt to deliver their care, they do so on a manner that is cost effective, so that they may in turn see a return on the investment that they are making in that patient. Now, don't get me wrong, no matter what, they're going to provide that patient the best care and quality possible, but they want to do it on a cost-effective basis so that they may see a return on the patient. Because if this patient is self-pay, they are going to have astronomical medical bills and may not be able to pay it back. Therefore, the hospital will basically face a financial loss on that patient. So they want to do whatever is possible in order to help that patient financially, so that their bills are not astronomical and that they may be more likely to repay their bill to the hospital, so that the hospital can avoid financial loss and do what's best for that patient medically and financially. So essentially, in the end, the barriers of healthcare are access, quality, and cost, and the true struggle is attempting to improve all three of those aspects without harming or worsening or avoiding one point while improving two others. And overall, the article really focused on how those two acts of the Patient Protection and Affordable Care Act really wanted to increase access, improve quality, and lower costs while beating the barriers of the iron triangle of healthcare. Thank you.